What is Home and Community-Based Care, HCBC, is a presentation for individuals, families, and professionals. It is for anyone connected to an area agency. It is presented by Granite State Independent Living's Financial Planning and Benefit Services. Please note that this presentation is focused on programs for adults 18 and older. Why do you need a HCBC waiver? Home and community-based care HCBC waivers offer a variety of home and community-based services that an individual that meets the criteria of a waiver may need in order to prevent institutionalization. What are the HCBC waivers? The HCBC waivers are in-home supports, IHS, choices for independence, or CFI. Please note that CFI used to be called the Elderly and Chronically Ill, ECI, and it sometimes is still referred to ECI within the Department of Health and Human Services. Also, CFI is usually referred to as CFI and not HCBC CFI. Another waiver is developmental disabilities, or the DD waiver, and then there's the acquired brain disorder, ABD waiver. For eligibility criteria, please see the following slides. How do you qualify for a waiver? You must be receiving Medicaid. The resource limits are the same as the Medicaid program you are enrolled in, if that's aid to the permanently and totally disabled, APTD, aid to the needy blind, ANB, Medicaid for employed adults with disabilities, MEAD, or Old Age Assistance, OAA. There can be a cost to you. It's called cost of care, depending on your income. An assessment of services needed will be done to see if you qualify for a HCBC waiver. Eligibility for HCBC-IHS. Children who have a developmental disability and meet the categorical requirements of a cash assistance and or Medicaid program may be eligible to receive community-based services through home and community-based care in-home supports if all of the following are met. The individual is under age 21. The individual's income and resources are within the limits. And the Department of Developmental Services role is continued on the next slide. I just wanted to mention that if there is a child who's 18 to 21 and has just Quimby or Slimby to pay their Medicare Part B premium, they are not eligible for HCBC services. They have to be receiving cash assistance and or Medicaid. The Department of Developmental Services determines that the individual is eligible for area agency services. The area agency then establishes that the individual is appropriate for community-based services. The individual resides at home with their family. The Department of Developmental Services determines that the individual has certain individual and or caregiver factors which impede the caregiver's ability to care for the child. They also approve that the individual service agreement and individualized budget, which determine the cost of the needed services. The Department of Developmental Services determines that in the absence of HCBC-IHS services, the individual would require placement in an intermediate care facility. And lastly, the individual or the representative has chosen appropriate community-based care as an alternative to institutional care. Eligibility for HCBC-CFI. Individuals who are eligible for a cash assistance or Medicaid program may be eligible to receive community-based services through home and community-based care choices for independence if all the following are met. The individual's income and resources are within the income and resource limits. The Bureau of Elderly and Adult Services has determined there is medical necessity for the individual to receive nursing facility level of care. The individual's needs can be met with community services at the same or lower cost than the Medicaid cost of nursing facility level of care as determined by the Bureau of Elderly and Adult Services. the individual is residing in either an independent living arrangement or a residential care facility, and the individual or the representative has chosen community-based care as an alternative to institutional care, and a physician has approved the choice. Eligibility for HCBC-DD. Individuals who meet the category requirements of a cash assistance and/or Medicaid program. Again, if a person is just receiving Quimby Slimby to pay their Medicare Part B premium, they are not eligible for HCBC services. It has to be a cash assistance or Medicaid program. They may be eligible to receive community-based services through home and community-based care for individuals with developmental disabilities if all of the following are met. Individual income and resources are within the limits. Division of Developmental Services Area Agency establishes that individual is appropriate for community-based services. They determine the individual has a medical necessity to receive intermediate care facility level of care, and the individual or their representative has chosen appropriate community-based care as an alternative to institutional care. Eligibility for HCBC-ABD. First, how is an acquired brain disorder defined? An acquired brain disorder is a non-congenital condition affecting the brain or nervous system and prevents a severe lifelong disabling condition that impairs a person's ability to function in society. To be considered an acquired brain disorder, it must have happened before age 60 and be due to one or more of the following: physical trauma due to a car, motorcycle, bicycle, or other related physical trauma or occurrence, an infectious disorder such as encephalitis or meningitis, lack of oxygen to the brain, destruction to the myelin, which is the fatty substance which seals the nerves, and other inflammatory diseases, or other related disorders such as Huntington's disease. Eligibility for HCBC-ABD. Individuals who meet the program category requirements of a cash assistance and/or Medicaid program. Again, if a person just receiving Quimby Slimby to pay their Medicare Part B premium, they are not eligible for HCBC services. They have to be receiving cash assistance and/or Medicaid. They may be eligible to receive community-based services through home and community-based care for individuals with an acquired brain disorder if all the following are met. Individuals age 22 or older. Individuals' income and resources are within the limits. The Department of Developmental Services Area Agency establishes that the individual is appropriate for services. They determine the individual has a medical necessity to receive skilled nursing or a rehabilitative level of care, and the individual or the representative has chosen appropriate community-based care as an alternative to institutional care. If you noticed, in all 4 HCBC waivers that I have mentioned in this presentation, the individual and or the representative has chosen for them to stay in the community instead of putting them into institutional care. And that is the main focus of these waivers and the services the area agencies provide. Want more information? Here's how you can get more information. You can view other videos to learn more information about other programs. You can contact Granite State Independent Living for assistance at 877-809-7028. That is for the Financial Planning and Benefit Services Program. Our website is www.gsil.org, or the email for Financial Planning and Benefit Services is benefits@gsil.org. You can visit New Hampshire Work Incentive Resource Center for more resources at www.nhwirc.org. For home and community-based care waivers particularly, you would want New Hampshire's Department of Health and Human Services for more details. Their website is www.dhhs.state.nh.us. You can also contact your area agency for more information on home and community-based care waivers.